Town hall meetings, over 1,000 pages of the House health care bill, confusion over its contents, the rush to get this legislation passed. Insurance companies are worried. What is the projected cost of the reform? Will the quality of health care suffer? All of these issues have been flooding the news as Americans seek to understand the overhaul in the health care system and what it will do to them. So what's all the fuss about? Aren't there millions without health care? Shouldn't we all have it? Exactly how many don't have health care who actually desire it? Estimates range from 2 or 3 million to 47 million if you include illegal aliens and those who do not desire health care because they are young and vigorous and don't feel they need it. The question is, should all Americans pay for illegal aliens to have health care? But shouldn't we care for those who need health care and can't afford it? I believe so. The biblical principle was to set aside funds to care for those who needed help. Here are some of the issues from the health care bill that cause concern. Senior citizens are troubled. They may be denied the care they need. Pro-life supporters don't like the wording regarding funding for abortion. Small business owners don't like the prospects of being taxed for lack of the public health plan. Insurance companies worry about being forced out of business. Will the government be involved in individuals' private accounts? Will the government decide on your treatments and benefits? Should doctors' salaries be monitored? What about the cost of such a program as currently being proposed in the House of Representatives? Figures range from $600 billion to over $1 trillion. Who will pay for this? Will this add to the already sky-high deficit? President Obama has said he will not sign a bill for health care reform that adds to the deficit. How will this all-encompassing program be paid for? Higher taxes, maybe? While health care is very important, passing on its debt to our children and grandchildren is also extremely important. Many do not want their family's future saddled with more debt. As the debate continues in town hall meetings and in the media, one thing is clear: there is much opposition to the current plan. Health care is important, but there has to be a system that will not penalize over 60% of Americans who are currently happy with their present plans. Will Congress rush this bill through to support the president's zealous agenda, or will they carefully read the 1,000 pages of the bill and decide that this is too ambitious for the American people to handle at this time? Soon we will know the answer when our lawmakers resume their work in September. For GN Magazine, I'm Gary Antion.